You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. 4 million people worldwide have died of COVID-19. Folks, that is a devastating number. The cases, 186,618,097. Here in the United States, 34,677,918 reported cases and 622,235 deaths. Now, last week we told you about the Delta variant that is spreading rapidly and becoming the new dominant strain in the United States. Experts are saying another new variant, the Lambda variant, has already spread to 29 countries, including the United States, and is circulating heavily in South America. In North Africa, only 4% of Tunisia's citizens are vaccinated, which is twice the average across the continent. Countries are struggling with vaccination efforts due to a lack of accessibility. In Haiti, they're about to roll out their vaccination programs. Of course, they now have serious problems there because of the assassination of their president. Now, while other countries face the difficulties of the pandemic, the CDC is saying vaccinated teachers and students no longer need to wear masks inside school buildings. The CDC's new announcement follows a decline in COVID-19 hospitalizations across the nation and a national campaign making children as young as 12 years old eligible for the various vaccinations. Dr. Joseph Graves, Jr., professor of biological science at North Carolina A&T, joins us right now. Doc, glad to have you here. When we talked to you last year about COVID-19, you said there are going to be different strains. That was, I think it was March or April. We now are seeing that. The issue that we're now dealing with is the vaccinations that have been created. Can they counter these new strains?
Well, right now, the good news is that they can, but we don't know how long that's going to be true. So the problem that I've been consistently pointing out to as many people as I possibly can is that evolution works and the virus evolves. And currently, while the vaccines do protect against both infection and also, most importantly, hospitalization and death, there's no guarantee that that's going to continue to happen. And let me give you a really concrete example of this. In 1917, the influenza then acted very much like COVID does now in terms of mainly killing old people or people with pre-existing conditions. But after 1 year of evolution in the human species, by 1918, the 1918 variant killed across all age categories. And eventually the pandemic lasted 5 years and killed over 100 million people worldwide. And so my fear is that we're just beginning to see what COVID can do. And so the idea that people are falsely presenting is that we're somehow out of the woods is absolutely incorrect.
And the thing here is, I mean, you have these states that rush to open up. You have folks who are unwilling to take the vaccination. You've got conservatives who say, look, I'd rather die than take these vaccinations. You got people who are still acting a fool, upset with masks. And I'm sitting here going, y'all act like everything is all hunky-dory and all good. It's not. We've had Dr. Ebony Hilton, who's been on the show. She said a friend of hers who was vaccinated actually got COVID. Other people have talked about that as well, them having the vaccination and still getting COVID. So you still got to take precautions.
Yeah, absolutely correct. I mean, in the best of cases, the vaccines prevent infection of the Delta variant at 79% Moderna and 64% for Pfizer. But that means that 21% and 36% of people will catch the Delta variant even if they're infected.
All right, so hold on. I want you to repeat that. If you had the Moderna shot, I've had that one. What's the percentage?
The percentage is 21% can still catch COVID even if you've had the Moderna shot, and that's basically 1 in 5.
Pfizer.
And the Pfizer is 64%, which means 36% can catch COVID, and that's basically 1/3.
J&J.
I don't know what the numbers are for J&J yet, so I can't speak to that. But most unlikely, I mean, I would say very likely it's in the same range as Moderna and Pfizer. And so the point here is that right now, even though the vaccines protect you from catching COVID, it's still preventing people from being seriously hospitalized or dying. But we don't know how long that's going to last. And here's the problem that I've consistently tried to warn people. The larger the number of people are who are not vaccinated, the larger the opportunity is for the virus to evolve more transmissible and more dangerous strains. And that's why when I spoke with you back in March of 2020, I argued that it was really important for us to drive down the number of people infected, not just in the United States, but worldwide. There needs to be an international effort to get vaccines out and to bring down the number of people infected as soon as possible. If we fail to do this, and unfortunately we are failing to do this, we are going to see more and more and more dangerous strains. And so far, we haven't seen a 1918 influenza that kills everybody. But I hate to say it, and I hate it when I'm right, but if it continues on this path, I will say we will definitely see a more dangerous variant coming along in the not too distant future.
And this is also why, we've made this point that you've got to have the federal government putting the resources, and I keep saying it, putting it in Black-owned media, putting it in other forms to communicate to people the right information. And it doesn't help when you have these assholes at Fox News and OAN and Newsmax who are constantly out here fighting vaccinations, fighting masks, saying it's time to stop wearing masks on buses and trains and airplanes. And I'm like, are you idiot? Do you fools realize what's actually going on?
Yeah, and you're absolutely right, Roland, because quite frankly, reports have demonstrated that if the federal government had acted in a concerted manner in January of 2020, we could have prevented now some 500,000 deaths, or close to 500,000 deaths. So I lay all those deaths at the doorstep of Donald Trump and the people in the Republican Party and in the right-wing conservative media that enabled his crazy messages to go to the public. These people are irresponsibly killing people that did not have to die. So somebody's listening to us right now, African Americans listening, and they're like, hey, doc, I don't care. I'm just not going to take this vaccine. Basically, what you're doing is you're playing Russian roulette with your life. The reality is you can very well die. If you take the vaccine, what you're saying is even if you get the Delta strain, you're not going to be as in bad of a shape as folks who do not have the vaccine. Correct. Vaccination will still save lives with the Delta variant. And quite frankly, this comes down to not just a question of saving your own life, but saving the lives of the people you love. And I have to believe that people still do love other people besides themselves. And so, the longer we go with people not vaccinated, the more we are essentially, using the word Russian roulette, or rolling the dice towards an apocalyptic pandemic. Now, again, I characterize COVID right now as a level 3. But this non-vaccination, this anti-vaccine campaign is driving us in the direction of a level 4 and a level 5. And we have an opportunity now to stop this. And if we don't, future generations are going to look at this foolishness, and that's if we have future generations, which are not at all guaranteed if we keep this nonsense up. But they're going to look back at the foolishness of this generation, and we will be held account.
Dr. Joseph Graves, professor of biological sciences at North Carolina A&T University. We certainly appreciate it. Thanks a lot.
Thank you, Roland.
Folks, back to our Roland Mark Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses, the Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.